Welcome to the PubMed Daily Review for June 1st, 2026. Today we scan 974 new open access papers across 386 journals. In this video, we'll cover 10 trending research topics and 10 selected papers for detailed analysis. Trend 1 of 10, Livestock Health and Management. This trend explores diverse aspects of livestock health, including reproductive issues, nutrition, disease impact, and advanced monitoring and diagnostic techniques. This cluster covers 26 papers. Representative work includes environmental estrogens and animal reproductive health, mechanisms, biomarkers, and intervention approaches, effects of replacing porcine blood meal with rumen-protected lysine, while maintaining metabolizable methionine supply, on performance, nitrogen use efficiency, and nutrient partitioning in dairy cows, and automated dairy cattle body condition score using side view images and deep learning. Trend 2 of 10. Specialized clinical medical research. This trend encompasses focused clinical investigations into specific diseases, diagnostics, treatments, and patient outcomes across various medical specialties. This cluster covers 106 papers. Representative work includes return to sport after ulnar collateral ligament repair and reconstruction, full thickness versus rectal suction biopsy for the diagnosis of Hirschsprung's disease, study protocol for a prospective, randomized open-label, within-patient crossover trial, and images in nephrology, announcing the winners of the 2025 BMC Nephrology Image Competition. Trend 3 of 10, Student and Community Well-Being. Research exploring diverse facets of well-being, including mental, physical, and financial health, across student and community populations, and methods for its study. This cluster covers 97 papers. Representative work includes suicide attempts, self-harm, and suicidal ideation among Norwegian university students with eating disorders and disordered eating. The SHOT Study 2018 and 2022, Diet and Sleep Among College Student Populations, a systematic review, and caregiver report of the experiences of infant and child diaper insecurity, social support, and utilization of resources to help meet basic family need in the United States, a nationally representative cross-sectional survey. Trend 4 of 10, Dementia and Neurological Disorders. Research on dementia and neurological disorders, including their mechanisms, care, and relevant methodologies. This cluster covers 99 papers. Representative work includes institutional special needs plans and end-of-life outcomes for nursing home residents with dementia, overtreatment and therapeutic nihilism in chronic epilepsy, a call to action, and IntelliProfiler 2.0. And integrated our pipeline for long-term home cage behavioral profiling in group-housed mice using eHive 2D. Trend 5 of 10, Microbial Threats and Epidemiology. Focuses on understanding, surveilling, and responding to diverse microbial pathogens and their impact on public health. This cluster covers 111 papers. Representative work includes beyond past Ebola outbreaks, delayed detection, preparedness gaps, and the vaccine race during the 2026 Bundibugyo virus outbreak, longitudinal wastewater-based surveillance of vancomycin-resistant enterococci in tertiary care hospitals, and the light and shadow of medical mycology from the perspective of a return to the origin. Trend 6 of 10, Varied Scientific and Applied Research. This trend encompasses diverse scientific investigations and their practical applications across multiple disciplines. This cluster covers 149 papers. Representative work includes Erratum, linking fruit and stone morphology with germination and polyembryony in 2 mango genotypes, Oler and Karukin, and soft mode origin of charge ordering in superconducting Kagome CSV, 3, SB, 5. Trend 7 of 10, Global Health and Clinical Practice. Analyzing clinical practices, interventions, and health outcomes across diverse global and regional healthcare settings. This cluster covers 118 papers. Representative work includes efficacy and safety of intravenous lidocaine in thyroidectomy, a systematic review and meta-analysis with trial sequential analysis and meta-regression, differences in inpatient hypertension management practices between specialists and non-specialists in Zhejiang Province, China, and regulatory definitions and classification of biosimilar medications across the 6 regions of the World Health Organization, a scoping review. Trend 8 of 10, Oncology, Genomics, and AI Imaging. Advancing cancer research and patient care through genomics, AI imaging, and innovative biological models. This cluster covers 96 papers. Representative work includes organoids as next-generation models for investigating intracranial tumors, development of educational guidance sessions for adolescents and young adults with cancer and their caregivers, a component of the AYNAV intervention, and neighborhood deprivation and oncotype DX recurrence scores among Black and white women. The interplay between race, place, and tumor biology. Trend 9 of 10, Cellular and Molecular Biology Research. Investigating fundamental cellular processes, molecular mechanisms, and disease pathogenesis using advanced biological techniques. This cluster covers 117 papers. Representative work includes misplaced nucleic acids as a trigger of coagulaging, BCL2 inhibition in acute and chronic pancreatitis. Is there a therapeutic perspective? And single-cell RNA sequencing profiles reveal the developmental landscape of hawthorn leaves. Trend 10 of 10, Neurological and Systemic Case Studies. Examines detailed clinical cases illustrating complex neurological and systemic conditions and their interconnections. This cluster covers 55 papers. Representative work includes lumbar ventricular cerebrospinal fluid pressure discrepancy in leptomeningeal metastasis-associated intracranial hypertension, monoclonal gammopathy of clinical significance, a multi-system disorder requiring a multidisciplinary approach, and risdiplam treatment in adults with spinal muscular atrophy, a single-center, real-world study. Up next, our first paper out of 10, Elucidating Disease Pathogenesis Using Formalin-Fixed Paraffin-Embedded Samples, Integrating Genomics, Spatial Transcriptomics, and Histology. A focus on vascular anomalies by Katsutoshi Hirose and Yumiko Hori from Department of Oral and Maxillofacial Pathology, the University of Osaka Graduate School of Dentistry, 1-8 Yamadoka, Suida, Osaka, 565 Japan. This paper was selected because it highlights the transformative potential of integrating advanced molecular techniques, such as spatial transcriptomics, with traditional histology on widely available formalin-fixed paraffin-embedded (FFP) samples, thereby unlocking vast archives. Let's break down its key contributions. This paper explores how we can get more out of FFP samples, which are so common in pathology. We're talking about integrating advanced techniques like genomic profiling and spatial transcriptomics to really understand diseases at a molecular level. It's a big step towards more precise diagnostics and treatments. This review focused on how to best utilize FFP samples for advanced molecular studies, particularly in vascular anomalies. It examined the integration of next-generation sequencing for genomic profiling and spatial transcriptomics, highlighting the current challenges like nucleic acid degradation that need to be overcome for a unified approach. The review showed that NGS-based genomic profiling from FFP samples can pinpoint disease-driving mutations, offering crucial diagnostic and prognostic insights. Complementing this, spatial transcriptomics provides invaluable spatially resolved gene expression data, linking molecular findings directly to tissue architecture. The authors emphasize that combining these powerful techniques allows for a much deeper understanding of multilayered disease mechanisms, paving the way for more accurate diagnoses and personalized treatment strategies. This review really underscores the immense potential of combining genomic profiling and spatial transcriptomics with readily available FFP samples to revolutionize our understanding of diseases. However, we still need to tackle challenges like nucleic acid quality and workflow standardization. Moving forward, developing unified protocols will be key to unlocking the full power of these technologies for precision medicine and advanced diagnostics. Up next, our second paper out of 10, Prevalence and Genotype Distribution of Cervical Human Papillomavirus Infection Across Cytology, a nationwide, cross-sectional study of over 1 million Chinese women from 2020 to 2024 by Di Gao and Xiaosong Zhang from Department of Obstetrics and Gynecology and Reproductive Medicine, Peking University, First Hospital, Beijing, China. This paper was selected as the top choice because its nationwide, cross-sectional study of over 1 million Chinese women provides an unprecedented scale of real-world epidemiological data on HPV prevalence and genotype distribution, which is critically. Let's break down its key contributions. Cervical cancer screening paradigms are evolving globally, and China is actively developing its national HPV immunization strategy. Despite these efforts, there's been a gap in large-scale, real-world epidemiological studies that systematically characterize the distribution of HPV genotypes across different cervical cytological findings. This study aimed to fill that gap by investigating the prevalence and genotype distribution of HPV infection in China, providing crucial insights for optimizing screening and vaccination policies. This was a large-scale, nationwide cross-sectional study conducted in China. Researchers analyzed de-identified data from over 1.19 million women aged 20 to 79 years who underwent routine co-testing for HPV genotypes and cervical cytology. Samples were collected and tested for 23 HPV genotypes using standardized procedures. The study then classified HPV genotypes by risk and cytology categories, allowing for detailed analysis of prevalence and genotype distribution across different cytological findings. The study found a substantial burden of HPV infection in China, with an overall weighted prevalence of 17.0% for any type HPV and 13.1% for high-risk HPV. Interestingly, the most prevalent genotypes were HPV52, HPV16, and HPV58. We observed a dramatic increase in HPV infection prevalence, from 11.4% in women with normal cytology to a striking 73.0% in those with atypical squamous cells of undetermined significance or worse. Furthermore, the genotype distribution shifted significantly, with HPV52 and HPV58 dominating in normal cytology, while HPV16 became most prevalent in more abnormal cytology. This study underscores the significant burden of HPV infection in China, identifying HPV52 and HPV58 as key prevalent genotypes alongside the globally dominant HPV16. The observed shifts in genotype distribution across different cytology grades strongly suggest that future cervical cancer prevention strategies should incorporate genotype-specific risk stratification. Ultimately, these robust findings offer valuable evidence to guide and enhance China's national HPV vaccination and cervical cancer screening programs, ensuring they are as effective and targeted as possible. Up next, our third paper out of 10. Arginine deprivation enhances ASS1 negative glioblastoma radiosensitivity via epigenetic silencing of DNA repair genes by Nan Wu and Nellifer Syed from John Fulcher Molecular Neuro-Oncology Laboratory, Department of Surgery and Cancer, Imperial College London, London, UK. This paper presents a highly impactful and novel therapeutic strategy for glioblastoma, one of the most aggressive and treatment-resistant brain cancers, by demonstrating that arginine deprivation enhances radiosensitivity through epigenetic silencing of DNA repair genes directly. Let's break down its key contributions. Glioblastoma, or GBM, is a devastating brain cancer with very limited treatment options and a high rate of recurrence. Current therapies, like surgery and radiotherapy, often fall short, leaving patients with a poor prognosis. This highlights a critical need to discover new ways to make our existing treatments more effective and ultimately improve patient survival. This study explores a promising new approach to tackle this challenge. Researchers investigated this question using a multifaceted approach. They started with ASS1 negative glioblastoma cell lines and then moved to more complex models, including patient-derived tumor cells and even a patient-derived xenograft, or PDX, model. The core intervention involved arginine deprivation using ADI, PEG20, combined with radiotherapy. They meticulously analyzed changes in DNA damage and gene expression, particularly focusing on epigenetic modifications, to uncover the underlying mechanisms. The findings were quite compelling. They observed that low ASS1 expression in glioblastoma was linked to a higher capacity for DNA repair and a worse prognosis. Crucially, arginine deprivation with ADI, PEG20 not only selectively inhibited the growth of ASS1 negative GBM cells, but also significantly amplified the DNA damage caused by radiotherapy. This amplification was rapid, peaking within an hour. Mechanistically, this effect was attributed to the epigenetic downregulation of key DNA repair genes like PRP1 and LIG1, driven by an increase in the repressive H3K27Me3 histone marker. This research offers a significant step forward, suggesting that arginine deprivation could be a powerful new tool to make radiotherapy more effective for patients with ASS1 negative glioblastoma. The discovery of the epigenetic mechanism behind this sensitization is particularly exciting, opening new avenues for targeted therapies. Looking ahead, the findings strongly advocate for investigating combination therapies, specifically pairing arginine deprivation with PRP inhibitors, to maximize therapeutic benefits for these challenging cases. Up next, our fourth paper out of 10. Tunable gene control via RNA splicing with a clinically approved small molecule by Mateusz Mendel and Lena Schucker from Therapeutic Modalities, Pharma Research and Early Development, Pred. F. Hoffmann La Roche Ltd., Basel, Switzerland. This paper was selected because it introduces a highly novel and clinically translatable gene control system, RISDON, which utilizes a clinically approved small molecule and endogenous splicing machinery to overcome major hurdles in the safety and efficacy of gene. Let's break down its key contributions. Gene and cell therapies hold immense promise, but their safety and effectiveness hinge on our ability to precisely control gene expression. Existing methods often rely on components that can trigger immune responses or use drugs not approved for clinical use, creating significant hurdles for bringing these therapies to patients. This paper tackles that challenge head-on. Researchers developed a novel gene control system called risdON, which leverages the clinically approved drug risdiplam. This system uses risdiplam-responsive sequences to precisely regulate gene expression through the body's own splicing machinery, avoiding immunogenic components. They tested risdON across various cell types, including human-induced pluripotent stem cells and primary T cells, and even demonstrated its function in living organisms using AAV delivery. The study demonstrated that risdON provides precise transgene control by utilizing the body's own splicing machinery, bypassing the need for external protein regulators. They observed robust and dose-dependent gene induction with very low background expression, which is crucial for safety. Furthermore, the system successfully controlled CAR expression in T cells and Cas9 for gene editing, showcasing its broad applicability. Importantly, they also achieved reversible transgene expression in living organisms using AAV delivery. This research introduces a significant advancement in gene control, offering a safe and highly controllable system for future gene and cell therapies. By leveraging a clinically approved drug in the body's natural processes, risdON overcomes key limitations of current methods. This platform's modularity and in vivo functionality pave the way for more precise and safer therapeutic interventions. We anticipate this technology will accelerate the development of next-generation treatments. Up next, our fifth paper out of 10, Droplet microfluidics with image texture quantification for detection of rare antibiotic-resistant subpopulations from bloodstream infections by Sagar N. Agnihotri and Maria Tinge from Department of Materials Science and Engineering, Uppsala University, Uppsala, Sweden. This paper was selected because it introduces a highly novel and clinically critical droplet microfluidics platform that rapidly and accurately detects heteroresistance, a major cause of antibiotic treatment failure, directly addressing one. Let's break down its key contributions. Heteroresistance, or HR, is a critical challenge in treating bacterial infections. It's when a small, resistant subpopulation of bacteria exists within a larger, susceptible group, often leading to treatment failure. Unfortunately, standard antibiotic susceptibility tests frequently miss HR, and the current gold standard is very slow and labor-intensive. This gap highlights a significant need for faster, more accurate detection methods. This study developed a novel digital phenotyping approach to tackle the challenge of HR detection. They utilized droplet microfluidics combined with image texture analysis to analyze various clinical isolates, including both gram-negative and gram-positive bacteria from bloodstream infections. This innovative method aimed to provide single-cell resolution and high-throughput analysis for identifying these elusive resistant subpopulations. The results were quite promising. This new method successfully detected HR subpopulations at incredibly low frequencies, down to 10-6. Crucially, it achieved this detection within 12 to 30 hours, which is significantly faster than the traditional gold standard PAP test. Furthermore, the platform offered both single-cell resolution and high-throughput capabilities, demonstrating its potential for efficient and precise analysis. This study represents a significant step forward in combating antibiotic resistance. By providing rapid and accurate detection of heteroresistance, this platform could revolutionize how we approach antibiotic therapy, leading to more targeted treatments. While promising, future work will involve validating this technology in broader clinical settings and integrating it into routine diagnostic workflows to ultimately improve patient outcomes. Up next, our sixth paper out of 10, NCAS7-11S3, a compact Cas7-11 variant with enhanced RNA cleavage and minimal collateral activity by Haili Wang and Qi Zhang from State Key Laboratory of Virology and Biosafety, College of Life Sciences, Wuhan University, Wuhan, Hubei, China. This paper was selected because it introduces a compact and enhanced CRISPR-Cas variant, NCAS7-11S3, that significantly improves RNA cleavage efficiency while minimizing off-target collateral activity, addressing a critical limitation. Let's break down its key contributions. CRISPR-Cas systems, like Cas7-11, are exciting tools for RNA targeting. However, Their large size has been a major hurdle for effective delivery, especially with AAV vectors. This limitation restricts their potential in gene therapy and other applications. This study aimed to overcome this challenge by engineering a more compact and efficient Cas7-11 variant. Researchers used a dual fluorescence reporter system in mammalian cells, specifically HEK293T cells, to evaluate different Cas7-11S variants. They systematically engineered and screened various mutants, focusing on improving RNA cleavage efficiency and reducing size. This iterative process of design and testing was crucial for identifying optimal modifications. The team found that adding a nucleocytoplasmic shuttling signal significantly boosted RNA cleavage. Through systematic screening, they identified specific mutations that led to both stronger cleavage activity and more compact structures. Ultimately, they developed Ncas7-11S3, which not only showed higher RNA cleavage, but also importantly, retained almost no collateral activity. This research is highly significant because Ncas7-11S3 provides a much-needed compact and efficient RNA targeting tool, paving the way for AAV delivery in gene therapies. The minimal collateral activity is a critical safety feature, making it a more precise and potentially safer option. Future work will focus on validating this variant in living organisms and exploring its broad applications in RNA editing. Up next, our 7th paper out of 10. Exploratory plasma ctDNA genomic biomarkers identified by whole exome sequencing and a novel bioinformatics pipeline in advanced driver-negative NSCLC by Luis Posada Dominguez and Alejandro Olivares Hernandez from Medical Oncology Department, Salamanca University Hospital, Salamanca, Spain. This paper was selected because it introduces a novel approach using whole exome sequencing of plasma ctDNA and an AI-enabled platform to identify predictive biomarkers for immunotherapy response in advanced non-small cell lung. Let's break down its key contributions. Immunotherapy has revolutionized treatment for advanced non-small cell lung cancer, but predicting who will respond remains a significant challenge. Existing biomarkers, like blood-based tumor mutational burden, haven't been consistently reliable. This study aimed to explore whether advanced genomic analysis of circulating tumor DNA could uncover new, more effective biomarkers to guide treatment decisions. Researchers conducted a prospective observational study involving 37 patients with advanced non-small cell lung cancer who were receiving immunotherapy. They collected baseline plasma samples and performed whole exome sequencing on the circulating tumor DNA, processing the data with a novel AI-enabled platform called Genomics. The goal was to identify specific genomic alterations that could predict how well patients would respond to their treatment. The study revealed several important findings. While blood-based tumor mutational burden didn't show strong predictive power, the advanced ctDNA analysis identified specific gene mutations. Notably, mutations in the CYP4F2 gene were associated with a nearly threefold increased risk of worse overall survival, with a p-value of 0.031. Similarly, TPSB2 mutations also showed a significant association with shorter overall survival. CYP4F2 mutations were also an independent predictor of shorter progression-free survival. This proof-of-concept study demonstrates that advanced whole exome sequencing of circulating tumor DNA, processed through platforms like Genomics, can successfully uncover new potential biomarkers. The identification of CYP4F2 and TPSB2 mutations as independent predictors of worse survival is a significant step forward. While these findings are exciting, they come from a small cohort, and larger studies are now crucial to validate these biomarkers and integrate them into clinical practice for better patient stratification. Up next, our 8th paper out of 10, Degradation-Controlled Synchronization of HIF-2 and MEK inhibition using self-sealed porous silicon nanoparticles to reprogram tumor immunogenicity by Juyung Song and Young-Hyun Lee from Department of Biomedical Engineering, Ulsan National Institute of Science and Technology, UNIST, Ulsan Republic of Korea, Institute for Stem Cell and Regenerative Medicine, ISCRM, University of Washington, Seattle, Washington, USA. This paper was selected because it introduces a highly novel and sophisticated biomaterial platform for degradation-controlled, synchronized delivery of multiple therapeutic agents, representing a significant advancement in targeted drug delivery and combination therapy for cancer. Let's break down its key contributions. Many cancer therapies combine different drugs, but often these drugs break down at different rates, leading to asynchronous target suppression. This can limit how effective and long-lasting the treatment is. Our research aimed to address this challenge by developing a novel approach to precisely control drug release. We developed a novel porous silicon nanoparticle platform designed for degradation-controlled drug release. This platform allowed us to independently load and co-administer two cancer drugs, belzutifan and trametinib, ensuring their synchronized intracellular availability. We then tested this system in both in vitro settings and Merkel cell carcinoma animal models to evaluate its efficacy and mechanistic effects. Our results showed that the PCNP platform successfully sustained the availability of both drugs for over 10 days in physiological conditions. This synchronized dual inhibition significantly enhanced cytotoxicity in cancer models compared to traditional free drug combinations. Importantly, we observed beneficial immunogenic remodeling, including increased calreticulin exposure and reduced PD-L1 expression, suggesting a broader anti-tumor effect. This study highlights that precisely controlling the timing of drug release is crucial for effective combination therapies, especially in cancer. Our PCNP platform provides a promising solution to achieve this synchronized inhibition, leading to improved anti-tumor effects and immunogenic changes. These findings open new avenues for designing more effective biomaterial-enabled combination therapies and warrant further investigation into their clinical applicability. Up next, our 9th paper out of 10. A widely used CRP aptamer does not bind CRP, revealing a general route to surface-driven pseudoaffinity in biosensors by Kwon-Duk Liu and Sergei N. Krulov from Department of Chemistry, York University, Keele Street, Toronto, Ontario, M3J1P3, Canada, Centre for Research on Biomolecular Interactions, York University, Keele Street, Toronto, Ontario, M3J1P3, Canada. This paper was selected because it uncovers a fundamental flaw in a widely used diagnostic tool, demonstrating that a common CRP aptamer does not bind its target and revealing a general mechanism of surface-driven. Let's break down its key contributions. Many biosensors rely on aptamers for specific molecular recognition. However, the rigorous validation of these aptamers, especially their binding activity, is often overlooked. This can lead to significant issues, as widely used reagents might not perform as expected. Our study aimed to investigate a specific, widely adopted CRP aptamer to understand its true binding capabilities. We designed our study to rigorously re-examine a DNA aptamer widely believed to bind C-reactive protein. We employed a multi-pronged approach, utilizing both solution phase assays and surface plasmon resonance, or SPR, to assess its binding characteristics. Our goal was to differentiate between genuine molecular recognition and any potential surface-driven pseudoaffinity that might be influencing previous reports. Our findings were quite striking. In solution phase assays, we observed no detectable binding of the aptamer to native CRP, which directly contradicted prior assumptions. Furthermore, when we performed SPR under carefully controlled, lower background conditions, there was no measurable ligand-specific response. Interestingly, we did find that CRP binds strongly to streptavidin-containing sensor surfaces even without the aptamer, suggesting that the originally reported affinity of 3.5 nm was likely due to this surface-driven pseudoaffinity rather than true aptamer CRP recognition. This study has profound implications for biosensor development and molecular diagnostics. It reveals that a widely used CRP aptamer does not actually bind its target, demonstrating how surface-driven pseudoaffinity can lead to false positive results. This underscores the critical need for rigorous validation, especially using orthogonal solution phase methods, before any aptamer is adopted for clinical or research applications. Moving forward, we must prioritize thorough testing to ensure the reliability of our diagnostic tools. Up next, our 10th paper out of 10, the Transcriptional Atlas, Intercellular Communication and Metabolic Reprogramming of the Cartilage and Synovium in Osteoarthritis Patients with Diabetes Mellitus. A multi-omic study by Inxian Wen and Liaobin Chun from Division of Joint Surgery and Sports Medicine, Department of Orthopedic Surgery, Zhongnan Hospital of Wuhan University, Wuhan, China. This paper was selected because it employs cutting-edge multi-omics techniques to unravel the complex molecular mechanisms linking diabetes mellitus and osteoarthritis, providing novel, deep biological insights into a prevalent comorbidity with significant. Let's break down its key contributions. Today, we're diving into a fascinating study that explores the intricate link between diabetes and osteoarthritis. While we've known for a while that these two conditions often coexist, the precise molecular reasons for this connection have remained elusive. This research set out to uncover those hidden mechanisms, aiming to shed light on how diabetes worsens OA. Understanding this relationship is vital, as it could pave the way for new and more effective treatments for patients suffering from both conditions. To unravel these complex interactions, researchers conducted a multi-omic study using human tissue samples. They analyzed knee cartilage and synovium from 21 patients, comparing those with OA alone to those with type 2 diabetes-associated OA. The team employed advanced techniques like single-cell RNA sequencing and metabolome profiling to get a detailed look at gene expression and metabolic changes. This comprehensive approach allowed them to identify key differences in cellular behavior and communication between the two groups. The findings were quite striking. In patients with diabetic OA, the synovial fibroblasts showed significantly enhanced differentiation, suggesting a more active and potentially damaging role. We also observed that pathways related to energy metabolism, blood vessel formation, and cell growth were highly active in the synovium. Crucially, there was a notable increase in specific cell-to-cell communication pathways between the synovium and cartilage, like HGF-MET. Conversely, the cartilage itself showed a pronounced suppression of metabolic activity, particularly in amino acid transport and glycan biosynthesis, indicating a compromised state. This study provides a groundbreaking understanding of how diabetes specifically impacts osteoarthritis. It clearly defines T2-DMOA not just as OA with diabetes, but as a distinct metabolic subtype, characterized by unique cellular and molecular changes. These insights are incredibly valuable, as they point to specific pathways and mechanisms that could be targeted for new treatments. Moving forward, researchers can now focus on developing therapies that address this disrupted communication and metabolic reprogramming, offering hope for better outcomes for patients with diabetic OA. That's all for today's PubMed Daily. If you found this helpful, please like, leave a comment, and subscribe for daily paper summaries. See you tomorrow.